Aurora's crisis response team is made up of two critical parts, an officer and a clinician. And then together, they're helping people during a mental health emergency. But that partnership is starting to have its own problems. The department is likely to remain without any clinicians for several more months. It's been that way for a month already. The organization that is providing the clinicians says Aurora is ending its agreement with them at the end of the year. Hiring more clinicians before then is going to be difficult. Here's Mark Salinger.
When an inmate on work release left a mental health facility in Aurora Sunday evening armed with a knife, no mental health clinicians were working to respond to the call as part of the city's co-responder program. In fact, there are no full-time mental health clinicians on staff right now as part of the crisis response team that may typically respond to a situation like this. Even if there was anyone working, we don't know if a mental health clinician would have responded. Turns out, Aurora 911 doesn't have protocols to determine whether a mental health crisis is occurring and how to handle those calls. That's according to an audit from the city released in June, which found a long list of problems with the crisis response team. The audit states Aurora police lacked strong policies governing interactions with individuals with mental health disorders. That's before the program dropped down to 0 clinicians.
I think the most important reason that we do not have clinicians right now is that the city decided to put this contract back out for bid.
Kelly Phillips Henry is the CEO of Aurora Mental Health Center. She says her clinicians were told by officers they work with that they'll likely need to look for new jobs before she even found out that the city was likely contracting with someone else 2 weeks ago. Now she thinks it'll be impossible to hire new clinicians in the next couple of months.
We hold this contract with them until December 31st. Unfortunately, we will not be able to recruit for these positions, right? Knowing that the contract is about to change hands.
The city of Aurora is now moving resources usually devoted to other calls to pick up the demand. The city's mobile response team, a different co-responder program separate from the crisis response team, usually responds to low-intensity calls for service involving mental health to allow police officers to focus on crime. Now, the clinician and paramedic riding in the mobile response team van are being called by police officers more often to respond to different types of mental health emergencies.
I think we're disappointed that this was the outcome. Our community deserves better.
I wanted to see if finding enough clinicians to staff a co-responder program is an Aurora problem or if other departments were facing the same challenges. For the dozen or so departments that got back to me that also have co-responder programs, no others are facing a shortage of clinicians as severe as Aurora.
So is there anyone currently responding to mental health calls for services right now that is a part of that crisis response team?
Yeah, the director of the program, who holds a managerial role, is trained as a clinician and can respond to calls when available. I'm told that's about 1 day a week.
All right, thanks so much for that, Mark.